Here are 10 surprising facts about IVF brought to you by me, Dr. Lucky Seacon, a double board certified OBGYN and fertility expert. I want to share 5 positive and 5 negative truth bombs that many of my patients find eye-opening whenever I'm discussing IVF with them. So let's start with the positives. Number 1, how successful IVF can be. In the best case scenario, with a beautiful euploid embryo, there's about a 70% chance of getting pregnant from your first transfer. In fact, a recent study that included 4,500 patients found that 95% of people who undergo 3 consecutive euploid embryo transfers will become pregnant. The second surprising fact is that IVF is shorter than most people anticipate. A lot of people think that they're going to be on shots to stimulate their ovaries for over a month. And when I tell them that it's actually 8 to 10 days, and then 2 days after the last shot, they're going to be ready for their egg retrieval, they are pleasantly surprised. The third fact is kind of related, logistical. You don't have to take a full 2 weeks off in order to go through an IVF stimulation egg retrieval cycle. You can work, or just going to be required to be in and around your clinic and available to come in for monitoring, and definitely to take the day of the egg retrieval off. But that's one day. It might fall on a weekend. So it's often less disruptive of a process than people will anticipate. And the next point that is very surprising to many, because you often think about IVF as being this aggressive treatment option because it is associated with higher success, but it's actually quite low risk. And, this is risks like internal bleeding at time of egg retrieval, 1 in 1,000 cases, if not less. Infection is very rare. And even complications from stimulation like ovarian hyperstimulation syndrome are increasingly rare. And when they do occur, they tend to be really mild, thanks to all of the advancements in the protocols and the ability to use low-dose HCG or avoid using HCG as part of your trigger shot, and the tendency to freeze all the embryos, wait for the body to cool off, and then perform an embryo transfer in a subsequent cycle are all things that have greatly reduced the risk of OHSS. Fact number 5 is how common IVF is. Normalizing it, understanding that IVF has existed for over 40 years, so this is not some sci-fi novel experimental technology, and there are now currently over 12 million IVF babies that have been born worldwide. And thanks to improvements in protocols, there's been major risk reduction. Things like multiple pregnancy, twins, triplets, which used to be very much associated with IVF, have become a thing of the past. In 2022, almost 96% of babies born from this technology were singletons, meaning not twins. Now I want to share 5 negative surprises when it comes to IVF. Number 1, while it is more successful than other treatment approaches, you can never say IVF is a guarantee. It's going to depend on your biology, and it's not a perfect resolution to overcoming all of the inefficiency of human reproduction. And there's still going to be the attrition that we talk about from egg retrieval to creating an embryo, and not every embryo is going to implant. Number 2, you're not going to know unless you try. There's no definitive or scientific way to predict your response and how many cycles exactly you're going to need to meet your goal number of embryos. For example, I've had patients at 43 who I share the stats with, and lo and behold, after 1 cycle, they get normal embryos. Sometimes it takes multiple cycles, and in some individuals, even after multiple cycles and all the effort in the world, they're not able to. So it really varies according to your biology. Number 3, PGT normal embryos are not perfect. Yes, PGT is a game changer in allowing us to select the best embryo for transfer, and it's gotten us really far. It's improved success and minimized risks of miscarriage. But not every PGT normal embryo has what it takes, because PGT is limited in what it can look at resolution-wise and in terms of the number of cells that are actually being tested and whether or not that's representative of the embryo's true reproductive potential. So there's a lot more when it comes to embryo biology that matters that isn't picked up by PGT. Number 4, IVF bypasses the tubes, yes, but ectopic pregnancy can still be possible. It's not the most common outcome, but the embryo can migrate after it's placed at the top of the uterus, and sometimes it's just bad luck. And lastly, number 5, not all clinics are created equal. Every lab has its own capabilities, quality control, success rates. And this is an uncomfortable truth, but where you do your treatment really can impact your success. In general, I think of bigger as being better. It's like when you're looking for a surgeon who does a certain procedure, the more procedures they've done, the better honed their skills are and the lower their complication rates tend to be. Looking for labs that routinely grow embryos to the day 5 blastocyst stage, do a lot of PGT, and clinics that are open to transferring mosaic embryos, they're up to date on the most recent literature. Those are just a few of many examples that I could give you about what to look for in a good clinic. So stay tuned for a comprehensive list.